So when this allergen comes into our body, it will sit on something called mast cells. So these mast cells will have a lot of things inside, and once this allergen comes and sits on the mast cell, it gets agitated, and then it will release a lot of things into the body. One of the most important thing that it releases is called histamine. Yeah, this histamine, it releases a lot of things, but histamine is a very important mediator of allergy. What it does is, it is the most important thing that is responsible for itching. Nasal blockage means nose gets blocked, no? That is because of histamine. Sneezing is because of histamine. And that heavy head feeling that you get when you have a cold is also because of histamine. So what these antihistamines do, as the name suggests, the antihistamine drugs will block histamines from acting on its receptors and having all these effects. So that's all. It is basically kind of a symptom relief for allergy. It is not a treatment for allergy, which is important. We have to have good symptom relief first. Otherwise, what is the point of treating? So first have symptom relief, then have this thing, disease control. So when we take an antihistamine, all these symptoms are to some extent controlled. So the next question is, are they safe? They are one of the safest group of drugs that are available to us. Yeah, they don't have much of side effects, and people can take it for years together without any major side effects. But overall, when we see, there are two groups of antihistamines. We call them as first generation, which were earlier discovered, and the latest new ones are called second generation antihistamines. So the problem with first generation antihistamines is, it makes you drowsy, it makes you sleepy, it will cause some dryness in your mouth, it will make you a little restless. Whereas the second generation are less drowsy. They don't cause so much of drowsiness. They don't cause so much of dryness of mouth. Even in second generation, the newer ones like the bilastine, the fexofenadines, these are all really less drowsy causing agents, and can also be given in those who are having kidney conditions, kidney problems, liver problems and all. So this is what antihistamines are about. They are a relatively safe group of drugs, very effective in controlling itching and rash and nasal stuffiness. You can take them, but if you are needing these drugs for more than a week, I would suggest that you should meet your allergy specialist before self-prescribing this, because these are available at any pharmacy. If you ask them, they will give you, but it might not be right, because remember, you are only treating the symptom and not the condition